The placement of a peripheral intravenous catheter is the most common advanced skill performed by paramedics. This skill provides the pre-hospital care professional with the ability to administer drugs directly into the bloodstream and give intravenous fluids. The next station that we will review is the intravenous therapy and medication station. This station is designed to evaluate your ability to establish a peripheral IV, administer an intravenous bolus of medication, and mix and administer a medication with the IV Piggyback method. The following directions will be read to you. This station is designed to test your ability to establish an IV and administer medication by the IV bolus and Piggyback methods, just as you would in the field. You will be required to establish the IV within 3 attempts. If you do not successfully establish the IV, you will not be able to administer IV bolus and Piggyback medications to the patient. Although we are using the mannequin arm, you should conduct yourself as if this were a real patient. You should assume that I am the actual patient, and you may ask me any question you would normally ask the patient in this situation. You have 6 minutes to establish the IV, 3 minutes to begin bolusing the patient, and 5 minutes to begin Piggyback medication administration. Do you have any questions? Next, a brief scenario will be read and instructions will be given.
You have been instructed to establish an IV and administer a bolus of lidocaine.
Okay. The first thing I want to do is select my fluid. I find here some normal saline. I want to check to make sure that it's clear. Is it clear?
It's clear.
Okay, and I want to check the expiration date, which is fine, and it is normal saline. I want to select a catheter. For this patient, I'm going to use a 20-gauge catheter. Okay, I want to select an administration set. I'd like to use a 60-drop administration set.
After the administration set is selected, the IV tubing is connected.
Okay, I'm going to fill the drip chamber.
The drip chamber is filled. Fluid is run to flush air from the tubing.
And I'm going to run the fluid through to clear air from the line.
After the bag is hung, pieces of tape are cut and set aside.
I'm going to observe universal precautions and wear gloves.
Before venipuncture, you must take or verbalize infection control precautions. Next, apply the tourniquet.
Okay,
After palpating the vein, the site must be cleansed. Now, preparations for venipuncture are complete.
Using alcohol. Okay, I'm ready to start the IV. To bubble up. Insert it. I'll observe the flashback in the chamber. Advance the catheter. I'm going to occlude the proximal vein. So I'm going to connect the tubing. Release the tourniquet. Run the IV wide to ensure that the fluid is running, which it is. Observe for any swelling. I don't see any, so I'm going to cut it back to KVO, about 1 drop every 6 to 10 seconds. And now I'm going to tape my IV in place.
Once the IV is established, there are 2 other phases of IV skills to be demonstrated: administering IV bolus medications and intravenous Piggyback medications.
Okay. At this point, I'm ready to begin bolusing the patient. I'm going to ask the patient if they have any allergies to medications that they know of. Sir, do you have any allergies to medications that you know of?
No, I don't.
Okay, since he has no allergies, I'm going to select my lidocaine. The concentration is 100 milligrams, it's 2% lidocaine, and it's 20 milligrams per milliliter. How much do you weigh, sir?
I weigh 154 pounds.
154 pounds, so that's going to be 70 kilograms. I'll administer 70 milligrams of lidocaine. Sample my syringe. I'm going to reconfirm that this is 2% lidocaine, 20 milligrams per milliliter. The expiration date is okay. I'm going to cleanse the site. I'm going to cleanse the port on the hub. I'm then going to expel the air from the syringe. Okay. At this point, I'm going to inject while I'm pinching off the tubing. inject 3.5 milliliters or 70 milligrams of lidocaine. Okay.
Okay. May I see the syringe? Okay.
Okay, I'm going to dispose of that. I'm now going to run the line wide open to flush the tubing. Okay, it's running wide. I'm going to now readjust it to a TKO rate. 6 to 10 drops per minute. Okay. And at this point, do I see any of the desired effects? Have the PVCs been abolished?
PVCs have been abolished.
Okay, so at this point I'm going to continue to monitor the patient for adverse effects.
Okay. You have been instructed to follow the bolus of lidocaine with a lidocaine infusion at 2 milligrams per minute.
Okay.
You have 5 minutes to begin administration of the medication.
Okay. The first thing I'm going to do is find the appropriate fluid. I have a 500 bag of D5 in water. Is the fluid clear?
Fluid's clear.
Okay, I'm going to check the expiration date. It's not expired. And I'm going to reconfirm that it is D5 in water. I've already confirmed the patient has no allergy, so I'm going to go ahead and take the lidocaine. This is a 2-gram lidocaine. It's not expired. Check the fluid to make sure that it's clear. Confirm that it is a 2-gram lidocaine. Is the fluid clear?
Fluid's clear.
Okay.
To continue this station, the candidate will cleanse the port of the IV solution bag and inject the correct amount of medication into the IV solution.
And inject the 2 grams of lidocaine. Okay, I need an administration set, so again I'm going to use a 60 drop set.
Choose an appropriate administration set. Assemble and attach the administration set to the IV bag.
Fill the blast chamber.
Next, prepare the administration set by filling the
run
drip
through
chamber
coil
and
under
flushing
there.
the tubing. Attach an appropriate needle to the administration set.
So again, I'm going to cleanse the port.
The port of the primary line must be
And I want
cleansed.
to administer 2 milligrams per minute of lidocaine. With the mixture I've assembled, that's going to be 30 drops a minute, or 1 drop every other second.
Okay.
The needle is inserted into the port and securely taped.
Okay.
I'm going to start the lidocaine infusion. 1 drop every other second.
The flow rate of the secondary line is adjusted, and then the flow of the primary line is stopped.
Okay, then I'm going to shut off my primary line. I'll need to continue to monitor
To
my
complete
patient
the
for any
station,
adverse
the candidate
effects.
verbalizes the
And I
need to
label
observe
my
the patient for the
fluid bag.
desired effect or adverse side effects, and the medication fluid bag is labeled. To successfully complete the first IV therapy phase of this station, take or verbalize infection control precautions prior to performing venipuncture. Establish and adjust the flow of the IV within the 6-minute time limit. Avoid contaminating equipment or the injection site. Avoid techniques which may result in catheter shear or air embolism. Establish the IV within 3 attempts. Dispose of needles in the proper container. For the IV bolus medication phase, begin medication administration within the 3-minute time limit. Avoid contaminating equipment or the site. Adequately dispel air from the syringe. Administer the proper drug and dosage at the appropriate rate of administration. Flush the IV tubing after injecting the medication. Dispose of the syringe and needle in a proper container, and remember not to recap the needle. Successful completion tips for the final phase, piggyback medications, are to begin administration within the 5-minute time limit, avoid contamination of equipment or the site, administer the proper drug and dosage at the proper rate, flush the IV tubing of the secondary line to avoid the potential for air embolism. Finally, remember to shut off the flow of the primary line. Now that we have reviewed the ventilatory and intravenous stations,